Well, welcome back to the morning show here on Arise News. It is no longer news that there has been an outbreak of cholera in Lagos and a number of other states in Nigeria. Currently, casualty figures are as varied as their sources, but everyone seems to be in agreement about the deadly nature of the ongoing outbreak, including the Nigerian Center for Disease Control and Prevention, UNICEF, and National Biosafety Management Agency. We are now being joined for a conversation on the need for public safety steps and closer collaboration between public and private health institutions by Dr. Blossom Maduafokwa, a public health physician at Lagos University Teaching Hospital and Public Relations Officer, Association of Public Health Physicians of Nigeria, Lagos Branch. Good morning, and it's great to see you on the morning show again.
Thank you so much for having me.
Good morning.
Good morning.
Good morning.
Now, there has been talks that there's a cholera outbreak across the country. There was reportedly 5 deaths in Lagos State in just 48 hours.
Yes.
Can you speak to us a little bit about cholera? Is it something you can catch? Is it solely from food? And what public health concerns, what we should really be concerned around, particularly now with the rainy season?
Okay, great. So cholera is an infection that affects the gut. It's caused by bacteria. Of course, we can't see we can't see visibly, but people can get cholera when they drink water that is contaminated by the bacteria, or they eat food that is contaminated by the bacteria, or even they touch tables or anything in the environment that is contaminated by the bacteria, and they eat with their unwashed hands. The reason we're really concerned about cholera is because of how rapidly people can lose their lives when they have cholera. Cholera comes with diarrhea. So diarrhea is when you pass more than 3 loose stools in a day. But with cholera, it has a characteristic kind of diarrhea that it's almost like running water. So the individual can lose a lot of fluids within a few hours. Someone can be talking to you right now, and within the next 2 or 3 hours has had profuse watery diarrhea, and the person has lost their life. So that's one of the reasons we're extremely concerned about cholera.
So what are the early symptoms of cholera, and what are the immediate actions one should take if they suspect that they've contracted this disease?
So like I just said, one of the key symptoms is diarrhea, watery diarrhea. The diarrhea is actually very characteristic. I don't know if you've ever parboiled your rice and washed it out. You know, that rice water, that's actually how the diarrhea looks. So it's very, very characteristic. Sometimes people have vomiting, people collapse very, very rapidly. So once you start having diarrhea, seek help at a healthcare facility so they can replace the fluids immediately. If you don't have access to a healthcare facility, one thing you can do is something we call an oral rehydration solution. So what you do is you boil 1 liter of water, mix it with 6 teaspoons of sugar and half a teaspoon of salt, shake it very well, and just keep drinking, replacing the fluid before you get to a healthcare facility.
All right, doctor, thank you. I'm wondering, what triggers an outbreak of a disease like this? I mean, all of a sudden, over 9-10 states in the country, we're now talking cholera. Is there something in particular that triggers it? And then secondly, within the medical circles, do we have an idea of those who are more susceptible in terms of fatality? 30 people plus are dead now. Will they be kids? Will they be elderly? Will they be those with low immunity? Do we have an idea of those who are dying? Okay,
those are great questions. So with cholera, cholera is one disease that we say is a respecter of persons. Cholera respects personal hygiene, and cholera respects good sanitation. So cholera will not thrive where there's good sanitation. So the reason we're seeing these outbreaks is because of the poor sanitation in our environment. We have a lot of overcrowding. People live in slums. There's a lot of open defecation. So what happens is when we have the rains, the floods wash the infected material into sources of drinking water. And sometimes, you go to the markets to buy your fruits, people use water that from questionable sources to wash fruits, and then people consume these fruits and vegetables. So this is why we're having these outbreaks. Usually we tend to see more outbreaks around this time of the year, during the rains, during the floods, etc. You spoke about people that will be more susceptible. Interestingly, up to 80% of people with cholera don't have symptoms.
Really?
Yes. So it's 20% of the people will have symptoms, but people that tend to have more severe disease, people that are immunocompromised, young children, people, for example, people undergoing, say, cancer treatment, people that have HIV/AIDS will have more severe disease. But not to say that even people, just ordinary people, can't have more severe disease, but these are risk factors for severe disease with cholera.
Okay. Like you said earlier that it's around this time that we'll see such an outbreak. Is this year's occurrence, is this something that is much higher than expected? Is this like an outlier in terms of what usually happens in the country? Or so I want to know if it's an outlier or we're just reporting on it more, or the public health space is more tuned into what's going on and trying to help people. And also in terms of sanitation and our public health concerns, should we be concerned about any other thing like this happening in the future? You know, malaria, people always say stagnant water, but other outbreaks or other diseases, should we be, proactive in preventing another thing like this from occurring?
So to answer your first question, we've had many cholera outbreaks. Actually, I was discussing with someone this morning, people actually don't realize they used to have a lot of cholera outbreaks even in London. Before they instituted proper sanitation facilities. So cholera outbreaks usually happen when there's poor sanitation and we have a lot of sort of flooding. Sometimes we have natural disasters or insurgency and people are displaced, and then you have, say, people living in IDP camps, and then you have these outbreaks. So it's not out of the ordinary. It's just that people are becoming more interested in cholera, but cholera outbreaks have been happening for years.
Let's talk about future preparedness, because I mean, like you've just rightfully said, it's something that has happened in the past, it's happening now, and might happen again in the future. So what lessons can we learn from this current outbreak to better prepare us for future public outbreaks like this, health crisis, especially in terms of infrastructure and community engagement, so that people actually understand what causes this kind of disease?
So it's interesting because cholera, there are parts of the world where you don't really have cholera outbreaks. It's not anything that anyone even talks about because the facilities, the sanitation, environmental sanitation facilities are there, they are working. But in parts of the world where we're not investing as much as we should in ensuring that we have proper sanitation facilities for the populace, we will continue to have these problems. So we need to start there at the infrastructure level. And then the next level is the public, the community. People need to know what to do. So people need to know that open defecation is like a no-no. That's one. Secondly, wash your hands frequently. People actually underestimate the power of washing your hands. People don't realize washing your hands can actually prevent up to 70% of infectious diseases. So just as simple as...
Sounds like the COVID era all over again.
Exactly. It's like the same principles, but we have to keep repeating it. So washing your hands, extremely important. Make sure you don't drink water from questionable sources. Make sure if you're unsure, boil your water. When you wash your fruits, make sure you wash your fruits with clean water. Again, if you're unsure, just peel the fruits. There are things that we can do on a personal level to make sure that we protect ourselves. But at the level of the government, there are also things infrastructure that needs to be in place, because you're saying, oh, don't do open defecation, but they don't have any facilities, so what are they going to do?
Yeah.
So there are things that we need to do at the level of the government and at the individual level as well.
Let me ask you a question that I'm sure a lot of people will be of concern to a lot of people because of the essence of today. Today is Salah. Today is also, what was that meant today? What they call it? Father's Day.
It's funny that
You know, all the symbolism. Anyway, my interest would be, what would be your advice for the next 3 days? Salah Day and the 2 public holidays. Salah because of the Salah meat. You know, the point about Salah meat is not just that you are eating. It is the shared communal thing, and people are dipping their hands into the same meat. Sometimes they cut and share. I get the point of washing hands constantly.
Yes.
But do you think that will suffice for the next 3 days?
So we really have to make the efforts, because I mean, if you've ever seen a case of cholera, it's heartbreaking. It's like someone is talking to you this minute, like the next 3 or 4 hours, the person is like gone. It's something that can be prevented. So what we can do, like I had an event yesterday, I had to place hand sanitizers everywhere so that people, because it's not every time you have ready access to running water and soap. So you can use your hand sanitizer before you get to somewhere you can wash your hands. So this period, I will advise people to make sure that wherever they're eating their Salah meat, make sure you're sure of the source, 1. 2, but before you eat, make sure you wash your hands or you use your hand sanitizer. It's extremely important. You can actually save your own life just by that simple act.
So I want to say, because this idea of somebody talking to you and then 4 or 5 hours later they're gone seems very scary. But you said 80% of people who have cholera have no symptoms.
Yes.
So say 20% have symptoms. But I believe, I want to know the casualty rate. Is it 5%? Is it less? And also, yes, I think that I want to clarify, because it does sound scary now. It sounds scarier than COVID.
Yeah, so it depends on the healthcare infrastructure. So, for example, there was actually a case of cholera in some country in Europe, like just in the past few months.
I think
it was imported, actually, but the person didn't lose their life because they have free access to healthcare. So in this part of the world, for example, someone starts to have diarrhea. You're thinking, I don't have money to go to the hospital. So you're waiting and you're praying and you're believing God, you're doing everything that we Nigerians do. But then it gets to the point where the person realizes, I need to get to the hospital. And then the person gets there, but it's too late. So it's a part of the problem. So you said what we call the case fatality rate, like how many people will die that have it. The reason it's a little higher than it should be in this part of the world is because of the health-seeking behavior of Nigerians. And what impacts their health-seeking behavior is access to healthcare. So because people don't have ready access to healthcare, they seek help late, and that's why people lose their lives. So it's a major problem. So it's a sectoral solution that we actually need.
Yeah.
I mean, I wonder if, resources like, of course, like cholera kits, IV fluids, rapid test kits, but most especially vaccination, the oral cholera vaccines, like what role it plays in this. Is this something that could, quickly, bring this outbreak to a close?
So you raise a very important point. So with cholera, there's something we call levels of prevention. Yeah. So like levels of protection. So like what I just talked about, hand washing, etc. That's one level of protection. The next level of protection is the oral cholera vaccines. The problem is the vaccines are not readily available, right? So we have to rely on these personal hygiene measures. So it's difficult. It's unlike, let's say, our childhood vaccines, polio, etc. that we can give freely to all our children. It's not very, very easy to find the oral cholera vaccine. It's effective up to 2 to 5 years, but it's not something that is rolled out like on a mass scale. So it's rolled out maybe people that are at risk, for example, people that are vulnerable population, sometimes healthcare workers that have to care for these individuals, but on a mass scale, no.
All right, before we let you go, Doctor, I like the fact that you touched on the question of health infrastructure. How do you think we can ever return to, I would say, the good old days of when there were sanitation inspectors, wule, we used to call them in those days, and it was no intrusion. It was the duty of government to ensure that people comply. I doubt if that is going on anywhere in Nigeria today. It looks to me like government has basically ceded, yes, advocacy is going on, but they've ceded the responsibility to individuals to say, look after yourself. We're giving you advice. In the past, it was not an advice. This is how you must comply. Wule Wulembo was an important, that the sanitary inspectors are coming and you have to pack everything, make sure everything, Do you think we can ever return to that era?
So we do still have them. We do still have them. We do still have them. The problem is our population has grown so rapidly. So, and particularly in a city like Lagos, where there's overcrowding, people are surging into the city like every day. So it's difficult to have enough people to do what used to be done in the past. But they do have them, to be honest. So what we
I haven't
need
seen them in a while.
I haven't even seen Kai.
So we do have them, but I mean the city is 20-something million people. It's almost impossible and counting. So it's almost impossible to have enough people to go around to do that.
How do outbreaks such as this? How do they disappear when everybody is healed up? What will make the wave to go out? Yeah.
So it's part the emergency response. So people don't realize as soon as this outbreak was reported, an emergency response was kicked in. So we're doing surveillance, we're doing training. I actually did a training on infection prevention control a few weeks back. So the response has kicked in. So within a few weeks, you're going to see the outbreak abating. However, it's also seasonal. So as the rains taper off, you're going to see a drop-off as well. Yes.
All right. Okay. Thank you so very much, Dr. Maduafokwa.
Thank you so much for having me.
Thank you
so much. It's been very educational. Yes, and I feel a bit less afraid now. So I think that's actually fantastic. Thank you for joining us this morning.
Thank you.